Thank you, Sister Rhonda. Today we're going to be speaking on give your legs a lift. Why do we need to lift our legs? It's so important for us to find out. Now, the disclaimer, the health information in this lecture is for general education and is not intended to substitute for any medical advice. No medical cure, diagnosis, or treatment is provided. Proverbs 26, paragraph 2, part B says, the curse causeless shall not come. And Ministry of Healing reminds us that disease never comes without a cause, and we can find that on page 127. So what exactly is disease? Disease is an effort of nature to free the system from conditions that result from the violation of the laws of health. So what are the laws of health? Pure air, sunlight, abstemiousness, rest, exercise, proper diet, the use of water, trust in divine power. These are the true remedies. Sickness, suffering, and death are works of an antagonistic power. You see, Satan is the destroyer, but God is the restorer. Ministry of Healing, page 113. So here is a question for us. Which animal doctors said are the only ones who don't need compression socks? Is it A, cow, B,
No.
elephant, C, giraffe, D, horse? Yes, and it's the giraffe, you're correct. They have a lot of pressure on their legs, but the veins are concentrated in the center of their legs. And this came from Lower Extremity Review magazine, 2009 to 2023. So what is varicose veins? Varicose veins are abnormally large, bulging, bluish, lumpy-looking veins, often associated with dull, nagging aches and pains. Now, what are the causes? Malfunction of valves inside the veins. And this causes blood to flow from the arteries to the body that usually returns to the heart by means of the vein. So the veins have tiny valves to prevent the blood from flowing backwards into the arteries. But when the valves become stretched from excess pressure, they do not work properly. Circulation is impaired and blood accumulates in the veins, stretching and enlarging them. So this tells us exactly what causes varicose veins to happen. Now, phlebitis, which is inflammation of a vein wall, usually in the legs. It is more common in people who stand, persons who are doing a job where they are standing a lot or sitting a lot for too long. They can also develop varicose veins. If they habitually sit with their legs crossed, which a lot of people like to do, they can develop varicose veins because it can cause inflammation of the vein wall in the legs. If they lack proper exercise as well, if they are obese or if they lift heavy things, or during pregnancy, especially during the first 3 months. Or if a person have constipation, diverticulosis, hemorrhoids, hiatus hernia. If they are vitamin C and bioflavonoids deficient, this can weaken the collagen structure in the vein walls. So all these things can lead to varicose veins. Also, if they have hereditary tendency, or if they use hormone replacement therapy and birth control pills, All these can lead to persons having varicose veins. Now, do men get varicose veins? The answer is, of course, yes. The first person as a male that was diagnosed with varicose veins was actually King Henry VII of England. And that's because he was a very big person. He was almost 300 pounds, and he was the first male to be diagnosed with varicose veins. When people hear about varicose veins, they most often think of women. One reason is that pregnancy poses an additional risk factor for varicose veins. But the truth is that men get varicose veins too. In fact, it's estimated that 25 to 30% of the 4 million people in the United States with varicose veins are men. So it's not a female thing, as many would like to believe. Men get varicose veins due to a variety of risk factors, and these include family history of varicose veins, obesity, sedentary lifestyle, smoking, prolonged standing. Our veins have one-way valves that keep blood moving toward the heart. Varicose veins develop because these valves deteriorate and become ineffective, causing blood to pool in the veins. And this was taken from Men Get Varicose Vein Too, and it was from Brattleboro Memorial Hospital. So we can see here that research is showing that men are also coming up with varicose veins, and these are some of the causes that you will find where men are concerned. Is it common for men to get varicose veins? The answer is yes. It is a lot more common than most people think, because from the time you say varicose veins, people are thinking women. This is not for me. It's only women that get varicose veins. That's a myth. Men get them as well. According to a study published in the American Heart Association journals, 11 million men between the ages of 40 and 80 years old in the United States are affected by varicose veins. Though commonly associated with women, men who have visible veins popping up or raised on their legs are signs that varicose veins may develop. While varicose veins can be a cosmetic problem, they can become a medical issue that needs attention if they are not treated. For example, varicose veins are usually a symptom of chronic venous insufficiency, CVI. If not treated properly, CVI can lead to conditions such as venous ulcers or deep vein thrombosis, DVT, which is the formation of blood clots. So you see, if not treated, one thing can lead to another and another. Therefore, if a man notices a change in the appearance of his veins, he should consult a doctor to identify any underlying issues that may be present and reduce the risk of any long-term complications. And this came from Varicose Veins 2022, 8 Effective Ways to Prevent Varicose Veins in Men's Legs. So at what age do men start getting varicose veins? That is a question that many men have regarding vein disease or when varicose and spider veins begin to appear. Generally, varicose veins are more common in women due to hormonal changes during pregnancy. However, varicose veins can occur in men at any age and are usually caused by several factors. Most people develop varicose veins between 30 to 40 years old, but they can happen earlier for some men. While varicose veins are most common in people over 50, they can still occur in younger individuals who may be predisposed to them due to their family history or lifestyle choices. Spider veins also become more common with age, and men can start to see them appear in their mid to late 30s. Varicose veins 2022, 8 effective ways to prevent varicose veins in men's legs. Now, this is telling us that lifestyle choices are so important. If we just sit around and we are not active, and that is why the laws of health are so important. If we just sit around and we're not active, whether man or woman, you can cause yourself to develop varicose veins. Not being active, helping your blood to flow properly and to circulate through the body and through your extremities, your hands and legs, you can develop these problems as well. You see, God made this body for us to keep moving. And if we practice other lifestyle choices by sitting around, being sedentary, not moving, we are going to find ourselves in a lot of problems. So I am going to share with you a testimony of a friend of mine who has varicose veins and it's hereditary. Her mom before her had them a lot and she developed them as well. But one of the problems is this, the long sitting. She's one of those sedentary persons that would sit at work all day, would not get up and move around. And when she would get pregnant, they would actually burst. And she's not even aware of it. You would just see blood. And then when someone says, something about it, that's when she realizes what's going on. And she has them really, really bad. Now to the point where, well, doctors want to do something about them, but she doesn't want to. She said, she would prefer to die with them. She's already in her 70s now. But sometimes the aches and pains, it's so much that she has to use a cane. Now, I don't know if there is anyone here that's online that would like to share a testimony in regards to varicose vein. You can raise your virtual hand and we will give you the opportunity to speak. Okay, Sister Jessie May, you can unmute.
Hello again, everyone. Well, I think varicose veins is my nemesis. My mother had them really badly, and she had clotting issues. Um, Her blood sometimes wouldn't clot, and then at a later stage, there were just clots. And my mother, as long as I knew myself, she had these varicose veins where well, in those days, before even I became Adventist, high heels were in, but my mother was never able to wear any shoe, even with a little lift in her shoe, because the veins were so messed up. I just remember all my life my mother's foot being bandaged up or either in these compression stockings. And forever she would be in and out of the hospital because of these veins. And she had 4 skin grafts done on them because it was so bad that it burst out in an ulcer just by her ankle. And
Mm-hmm.
it was just in her later years, when my mother was a housewife, church worker, community kind of person. And well, I remember my mother say when she was finished with her housework and stuff, her foot will be so pulsing that she would agonize in pain. I mean, That saw was like the span of my hand. And even after four skin grafts still burst out. And I remember her always on bed with the foot elevated and her with a purse beside her with a pharmacy in that purse with all sorts of tablets, Daflon and painkillers en masse. And it was only in her later years, the last 6 years of her life, my mom died at 73. Um, she eventually got rheumatoid arthritis. But 6 years before that, um, we went to a doctor. Well, I didn't really know much about natural practice, and in church, you would hear about herbs to drink and whatnot. You'd hear a little tidbit about herbs, but not this big, what we are having now in these years, especially since COVID. So I took her to the doctor, and the doctor, he said to immerse her foot in salt water, use sterilized water and dissolve a pound of salt in there. And because with the varicose veins and that sore, my mother's foot on the sore started growing some kind of bacteria. It was like a green blanket. And my mother would have me with her scissors cutting off that it's like, wow, what would I describe it as? Thick green mucus that almost cake into, I don't know, a film that, well, with a scissors, you're able to cut off. We did some really crazy things in total desperation. And the doctor told us, soak this foot in salt water. I know it would go against some of your the remedies that we know now, but we just followed. We were just desperate. And then after to take sterilized water again and wash it out with normal soap, Lux soap, Palmolive soap, whatever, bath soap, and wash that out with sterilized water and then pat it dry and put Savlon or Dettol cream on it. And lo and behold, in decades, for the first time, I saw my mother's foot starting to get nice and pink. No green, nice and pink, and then flesh started to grow, skin started to grow, and then my mother's foot was healed. Sadly, she died of post-hepatic neuralgia because with all the steroids and stuff she was taking, she got shingles, and then one day reprieve, she was feeling so good, and then the next day post-hepatic neuralgia set in, and well, she couldn't take that pain. She died within after 10 days of shingles, 3 days in the nursing home, fourth day she died. But our resounding victory was the healing of that varicose ulcer. So, but my mother, what I would say in this testimony, I'm sorry, I don't know where
It's
the
okay. Go
Bible
ahead.
is, but it was a Gideon's Bible. My mother used to go to several physicians, and even though this physician was a Sai Baba physician, he didn't project his religion. He would find out what you were and give you things suited to your religion. So, he was a good family friend. And he gave my mother one day, he gave her Gideon's Bible, which is King James. And behind that Bible, my mother wrote a prayer. My mother quoted Matthew, where Jesus went through all the villages and everybody was healed. And she underlined that word all. All were healed. And my mother wrote a prayer of faith. And she did that must be about 4 years before that treatment. 4 years before that treatment, or eight, somewhere around there, but well before that treatment. And she wrote this prayer that she has hope in Jesus that one day her foot would heal. And my mother
Amen.
saw that prayer of faith answered before she closed her eyes. So even though she died of the post-hepatic neuralgia and the racking rheumatoid arthritis, she, in her mind, got victory, and she saw the hand of Jesus work through the healing of her varicose ulcer, where decades there was no healing. She saw that healing by the grace of God. So that's my testimony. But I have it too because I was a teacher. Well, I was trying to be a teacher. And I don't know, I can never sit down for my classes. And I had quite a number of classes for the day, hardly freeze. And even way into the evening. And I do have varicose veins, but I am very active. So I'm thinking out of all the causes, mine must be hereditary, but I'm listening. So
So
thank you.
you will see some answers here and some things. Yes.
I
Thank you
said,
so much for
I
your
must,
testimony, and I'm sorry for your loss. You
yeah,
know, if
so I must tell you, I must interject and tell you, right, we came for leaky guts, and I said a prayer, and everybody else said a prayer. But I specifically said, there's somebody who will be touched by the presentation, and look, it was for me because I'm always wondering about this varicose vein. So God answers
praise
prayers,
God,
everybody.
praise God. Yes. Even in my country as a little girl, there was a lady with the varicose vein ulcer on her foot, and doctors could not get it healed. But my mother and father, they were always like the naturopathic doctors that people would seek out because my mother knows how to put together a natural remedy. And my father as well. And they used the local remedy and healed that lady's leg. And when I came to the US, I bumped into her, and that was the first thing the lady said to me. She said, "I'll never forget what your parents did for me and healed my foot that doctors could not heal." So as we go on, we will see some things, and I'm going to explain some things further. So what are the symptoms of varicose veins? Visible distended veins, swelling, restlessness, leg sores, itching, leg cramps, especially at night, aching or tiredness or feeling of heaviness in the legs. Skin may have a tense or burning sensation. Hemorrhage under the skin may cause the skin to discolor, light brown to bluish, large, bulging, and lumpy veins. So when this happens, we need to look at our diet as well. We need to make some dietary changes. A high protein diet will increase blood clotting factors. So avoid animal products, milk, cheese, butter, ice cream, eggs, fish, turkey, shrimp, lobster, crab, beef, etc. We know we should not be eating these things. And see, there is a reason why we are being told that a plant-based diet is more nutritious and best for us. See, God in his wisdom knows what is best for his children. He created us. And all we need to do is to be obedient. Also, we need to reduce fat and refined foods, junk foods, fried foods, tobacco, alcohol, coffee, tea, caffeine drinks, chocolate, vinegar, baking powder, baking soda, apple cider vinegar, and hydrogenated vegetable oils. We know that all these things are unhealthy for us in more ways than one. We also need to eliminate sugar, high fructose corn syrup, and other artificial sweeteners from the diet, as these things can increase inflammation in the blood vessels. So we have simple protocols, and again, nothing that is being shared here is supposed to take the place of your medical advisor or your medical doctor. These are for educational purposes only. So I'm sharing here some simple protocol that I'll talk about. We have chia seeds, 2 tablespoons, or flax seeds, 2 tablespoons grounded daily. These can help to reduce pain and keep the blood vessels pliable, make them flexible, right? So we can put chia seeds or flax seeds on our meal, and it will help to keep blood vessels pliable. Now, I personally, because of the job that I'm in, I do a lot of standing, but I'm one of those who do not stand in one place, do not keep still. I will be doing circulation rock. I do different things because I do not want to be just there standing in one place because that's not good. So I always try to keep it moving. But I use chia seeds and flax seeds as well. And I also use lecithin, 1 tablespoon, 3 times daily with meals, because this is a fat emulsifier that aids in circulation. Bromelain in pineapples, very good as well, and can help to reduce the risk of clot formation in blood vessels. I love to eat pineapples coming from the Caribbean. You know, I love pineapples because we have a pineapple from my country that's called the Antigua Black pineapple, and it's a very sweet pineapple. So that love is still there, and it's one of the fruits that I always tend to buy a lot and enjoy. Now, as we can see here, I am not suggesting anything out of the way. These are foods. Persons may ask, what is lecithin? Again, this basically comes from your sunflower seeds, and they have their Now brand, and you just put it on your meal the same as you would the ground flax seeds and consume it, and it's good. It's tasty too. I actually like the taste. Now we can look at our diet as well. Eat a nourishing diet of fruits, vegetables, raw nuts, seeds, legumes, and whole grains. Cellulose, an outer layer found in vegetables and fruits, is good for relieving symptoms. Apples, pears, beets, Brazil nuts, broccoli, carrots, celery, green beans, lima beans, peas, brown rice, millet, buckwheat, amaranth. All these are very good because they have the outer layer that is called cellulose that is good for relieving the symptoms. So we can also get into the habit of using enough fiber in the diet. So you do not have to strain at the stool and keep the bowels clear, because straining also increases venous pressure on the legs and can cause you to develop varicose veins. Include in your diet garlic, ginger, and onions in your diet. Use in moderation pink Himalayan sea salt and all natural salt with all 84 trace minerals. Do not go with the white salt that is mainly sodium, because that is not going to help the situation at all. And drink lots of water to keep the urine color pale yellow to clear, because the water also will help to improve your circulation. So lifestyle changes to improve circulation. We need to exercise, walk for an hour daily. Regular exercise increases the body's ability to dissolve clots. Walking barefoot on early morning grass improves venous blood flow. And I'm going to pause and speak a little bit on this. There is something that we call grounding, right? It is important. Now, I'm not saying if you live in an area where you know that they spray and things like that and the grass is not clean, that you should go barefooted on that. But those of you who can, it's important that we take the shoes off early morning before any type of pollution, anything, and walk on the grass. It will help to improve your venous blood flow. It will help with your calcium and all that. Grounding is important. We have some degree of electricity in this body of ours, and nature will align with our bodies and bring our bodies balance in terms of even our blood flow. After rain, when we have the negative ions being released as well, we can walk on the grass barefooted. It is good for us to do. There are some type of grounding shoes out there that persons can use, but all are not created equal, because some of them have soles that would actually block the grounding process. So you have to make sure that you're getting the right ones. If it's an all leather one that has a very thin leather sole, it's okay. But I find that some of them are fairly expensive. Those that have the rubber sole may not work as well, because the rubber is not a good conductor. It's going to block that grounding from the earth to your body. So again, it's important that we walk barefoot on the early morning grass, because that too can help to improve our venous blood flow. So lifestyle changes, we can do the circulatory rock, hold on to a sturdy object, stand with our feet apart, step up on the toes and down and back on the heels. Repeat this for 300 to 400 times daily. Also, we can wear socks during the night to encourage blood circulation to the feet. You know, if we keep it warm, of course, we will encourage blood circulation. And if we're doing jobs where we are standing or sitting for long periods of time, we can use the compression socks. They have nice fancy ones that look good. And there are many different types out there. I wear them to work, and I wear the ones that even have the Tommy Copper, because I find that they work very well. So I use those. And you can also, doctors would also recommend that persons get the compression socks, and they will tell you how to measure, you know, the biggest part of your leg, especially around the calf area, so that you can determine what size you would need, because it's not supposed to be tight or uncomfortable. Okay. The other thing that you can do is to give your legs a lift. You know, lie down on your back like this, take your legs up in the air. If you want to do it beside a wall, if you want to do it in your bed, it is up to you. This too would help. So lifestyle changes. Wear loose clothing that does not restrict the blood flow. Wear supportive stockings that help to support varicose veins and prevent swelling. So it is important that we do not wear tight clothing. As we can see, the laws of health are coming into play here in terms of our lifestyle, in terms of the things that we should be doing. Because we want to make sure that the protective stockings that we are using, that they support the varicose veins and prevent swelling. So give your legs a lift, elevate your legs above your heart level for 20 minutes at least once a day. Elevate your feet in front of you while sitting down to read or watch television. Avoid long periods of standing or sitting. Take rest periods several times during the day to elevate your legs above heart level. Avoid crossing your legs, doing heavy lifting, and putting any unnecessary pressure on your legs. If you stand for long periods, shift your weight between your feet and take short walks. If you sit for long periods, or at least an hour, get up and walk around. After bathing, you can apply castor oil directly over the problem veins and lightly, notice the key word. I didn't say to rub vigorously, I said and lightly, because rubbing may not be the best thing. So lightly rub the oil on your legs from the feet up and maintain a healthy weight, because obesity contributes as well. So if you must travel now and you're traveling for distance by car, stop and walk around ever so often. Some persons want to sit several hours. They're driving from one state to the other and they want to sit the whole thing through. Not good. Do not let the circulation become sluggish. When it enters a low flow state, it can lead to a clot. Even if you're traveling on a flight, and one of the things I like to do is to get that aisle seat so that I can stretch my legs, I can get up and do my little exercises. I don't worry about who is looking at me or watching me. I make sure that I have that aisle seat so that I can do what I need to do. If you must lie in bed for a while, move your legs ever so often to increase circulation. Some people just want to lie still and don't move. Move your legs around. Help to increase circulation, increase that blood flow. Avoid smoking. It restricts the blood vessels. If you have phlebitis or clots of any type, you could have it again. It can come back. Surgery or prolonged bed rest increase the risk that you will have another attack. So keep moving. This body was made to move. Now, there are some supplements and herbal suggestion or recommendation, but I'm not saying for anyone to go and buy anything or take anything. That's not the suggestion. It's just for educational purposes only. Coenzyme Q10, 10 mg daily, can improve tissue oxygenation, which increases circulation and enhances immunity. Multivitamin and mineral complex. It should contain niacin to prevent clotting, vitamin C to strengthen the walls of the veins and arteries, and vitamin E to reduce the formation of varicose veins and phlebitis or inflammation. So these are just some suggestions, and these are things that have been known to assist persons with varicose veins. The other thing is, some people would say glutathione, some people say glutathione. It doesn't matter, tomato or tomato. Use as directed on bottle. It helps to protect the heart, veins, and arteries from oxidant damage. We have bilberry. Again, use as directed on bottle, and this helps to support the health of the connective tissue and veins. We have seaweed cure as directed on bottle, may substitute with kelp, because it is rich in minerals that help to build collagen. So these are the recommendation. And as you can see, the kelp capsule or powder, 2 capsules. We have vitamin D3. If we live in an area where we're not getting sunlight, it is good to take the vitamin D3 to aid in cellular repair and to relax the blood vessels. And also we have good old aloe vera gel that we can apply to varicose veins for a cooling relief. And those of us who love to plant like myself, I do have aloe in my house because it is also good to keep the air pure. I also use it for hair. I use the gel on my skin. I do so many different things with it. So it's good for us to know that there are things that God has provided that can assist. Witch hazel to relieve discomfort to the varicose veins. You can just wet a gauze with it and rub it gently over the veins. Bathe in your legs in white oak bark, the herb tea, and 3 times a day helps to stimulate the blood flow as well, just by bathing the leg in the tea. Simmer a strong tea and use the tea to make a compress, and you can apply compresses to affected areas. So you can wash with it, you can make a compress with it to help. And then we have hawthorn berries. We have the hawthorn berry powder, 2 tablespoons to 4 cups of water, boil for 15 minutes, steep for 40 minutes to 4 hours. You can drink it as water throughout the day, and this improves circulation in the legs. There are some other herbs like ginkgo biloba and gotukola as well. But these are just a few suggestions to show you that there are things that can assist. And here are some general instructions when we are preparing teas that we need to understand. Hard parts of the plant, such as roots, seeds, rhizome, or bark, these are things that would boil for 15 minutes and then draw for 40 minutes to 4 hours. Delicate parts of the plant, such as the leaves, the flowers, the buds, the stems, or clusters, these we bring to a boil and then we let them draw or steep for 40 minutes to 3 hours. And for combination now, if we're doing a combination, we would boil hard parts first for 15 minutes, then add delicate parts and draw or steep for 40 minutes to 4 hours. And then we drink as water throughout the day. Deuteronomy 29 verse 9 tells us, keep therefore the words of this covenant and do them, that ye may prosper in all ye do. You see, the God that we serve wants us to prosper and to be in good health. And he wants us to prosper in all that we do. But we have to keep all of his commandments and all of his statutes so that he can assist us to prosper and to be in good health. This brings us to the end of our presentation on varicose veins. We thank you for coming on. May the grace of our Lord Jesus Christ be with you. And now we're going to take a 5-minute break if you need to go and get your little water while Sister Rhonda sings for us, and then we'll come right back to question and answers. Thank you so much.
Dr. Ephraim, thank you, thank you, thank you. Sister Camille James is the one taking the questions, and Sister Rhonda is not going to sing right now. I'm sorry, but it's over to you, Sister Camille. Thank you, Dr. Ephraim.
Okay, give me 2 minutes.
Okay, sure. So while Dr. Ephraim is refreshing herself to come back and answer the questions, do take the opportunity to put your questions